So firstly, what is snoring? But snoring is a sound created from a turbulent airflow. It's noisy breathing during sleep. In very simple terms, if you were to place a camera on somebody and you were to observe their breathing during sleep while they're snoring, their breathing is going to be heavy. So it's either that the breathing volume is too heavy or that the airways are too small. So in other words, it's noisy breathing during sleep caused by the exchange of a large volume of air through a narrowed space. So we're dealing with two things here. Not just a narrow space, but also a heavy breathing volume, which in turn causes the tissues of the nose and throat to vibrate. The nose, depending on whether you're breathing through your nose, the throat, or the soft palate, depending on whether you're breathing through your mouth. It comes in two flavors. Very simple snoring is snoring through the mouth. The person is breathing through their mouth during sleep. Vibration of the soft palate. It will sound something like this. That's a sound that many of you are familiar with. The more difficult form of snoring is high upper airway resistance, in other words, snoring through the nose. And it's turbulent airflow in the nasopharynx and the oropharynx causing inspiratory flow limitation. Basically, the person is breathing heavy through their nose, and either their nose is constricted or the breathing volume is too much, and that creates a sound like this. Different sounds, different effects. The first one is very easy to address. When the person learns to keep their mouth closed during sleep, they stop snoring. The second one is more difficult to address. You need to decongest the nose, and you need to bring breathing volume down to normal levels.